Hi, I'm Dr. Ossi, and today I'm going to be presenting Module 4 on self-care and heart failure. So I'll be discussing three different general topics today. The first is taking back control in heart failure. The second is learning to notice your symptoms. And the last topic will be learning how to manage those symptoms. So what can you do to take charge of your heart failure? The best recommendations are to follow your treatment plan that you've established with your doctor. This includes, your medications that you're prescribed, as well as following any diet recommendations that we'll go more into later in this talk. Um, Also, following an exercise regimen, weighing yourself daily, and getting an annual flu shot, as patients with heart failure are at an increased risk for more serious flu infections. So, listed below are some tips for following your treatment plan. So, the first tip is to make sure you take your medications exactly as prescribed. If you have any difficulty remembering to take your medications, purchasing a pill box can be extremely helpful. These are relatively inexpensive and can be found at any local pharmacy. Also, plan for prescription refills ahead of time. If you know you have about 7 pills left, check to see on the bottle if you have any refills left. If you're uncertain of this, reach out to your doctor or pharmacist. That way, if you know you need a refill, you can ask for more before you run out. If you do miss a dose of a medication, do not take two of the same pills to make up for the missed dose. Please discuss with your doctor ahead of time about what to do if you miss a dose of a medication. If you experience any dizziness or any unpleasant side effects after taking your medications, please do not stop the medication. Discuss this with your doctor about what to do because sometimes these side effects can be temporary. If needed, reach out to your doctor or pharmacist to discuss affordable medication options. So, you can help support your heart failure by eating a heart healthy diet. So, what does this mean? This means following a low sodium diet. So, trying to eat less than 2 grams of sodium per day is ideal. Also, limiting our water and fluid intake. So, trying not to have more than 5 to 6 glasses of fluid a day or 1.5 liters of fluid a day. Eating fruits and vegetables daily is really important for supporting our heart health, as well as eating less red meats such as pork and beef, and switching to more leaner meats such as fish, chicken, turkey is also very helpful. Eating reduced fat, low cholesterol foods supports our cholesterol and heart health, as well as avoiding or limiting alcohol intake to about 2 to 3 drinks a week. Ideally, having 0 drinks a week would be best. Increasing your activity level is very important for helping your heart failure. There's many ways you can make exercise enjoyable. And this is a really a special dedicated time out of your day that you could make to do something good for yourself. It could be as simple as walking, riding a bike, swimming, playing a sport you like, or even joining a workout class or workout group. Just, find something that works for you. Depending on your stage in heart failure, there's a lot of different symptoms you may begin to experience. And noticing those symptoms ahead of time can help keep you out of the hospital and can help you live longer. Um, some of these symptoms are, trouble breathing, whether that's lying down or while sitting up or while walking. Swelling, this can happen in any part of your body, most commonly in your legs. Fatigue is a very common symptom that patients can experience. Dizziness or lightheadedness, decreased appetite, and a cough. Um, Something you can do to monitor these symptoms is to weigh yourself and monitor your swelling daily. If you notice your weight has gone up more than 2 pounds in a day or 4 pounds in a week, then it's time to reach out to your doctor about this. Don't just shrug these symptoms off. Um, Pay attention to them, and notice when things are getting worse. So, we previously discussed what symptoms to recognize. Now, what do we do about these symptoms? So, when to call your doctor? Call if you notice any weight gain. As I mentioned, it's 2 pounds in a day or 4 pounds in a week. If you're noticing any increased swelling in any parts of your body, palpitations, shortness of breath, or any dizziness. Okay, so call your doctor if you're experiencing those. Sometimes it's important to call 911. And the time to do that is if you're experiencing any severe chest pain, any persistent shortness of breath, especially if you're at rest, and if you've fainted or passed out at all, then it's time to call 911. Managing fatigue is very important in heart failure. It is a very common complaint in any stage of heart failure. So, some things you can do to help combat this fatigue is to ensure you're getting enough sleep at night. 7 to 8 hours of sleep is adequate for adults. If you're having any difficulty sleeping, reach out to your doctor because there's medications and things they can do to help facilitate restful sleep. Also, save energy. If you're noticing you're feeling very fatigued lately, and you have a lot of things to do during your day, let's say you want to go to the grocery store and you have two doctor's appointments and you have maybe something else in the evening, try to not overload your day with activities. Rather, try to space things out and plan for rest in between activities. Okay. And don't feel bad to ask for help. We all need help sometimes. I think, if you're experiencing a lot of shortness of breath with lifting, or if you just need help with cooking or preparing food, don't feel bad reaching out to your support system. That's what they're there for. Thanks so much for listening. Take care.